A very good evening, distinguished professionals, my dear colleagues. I, Muhammad Aliullah, welcome you for this webinar on professional optometry, education, and its future. Now, as we all know, it is being broadcasted on technical or electronic broadcasting medium, so there could be some issues during the thing. Please stay connected. We should be back. Now, without wasting my time, I request Optom Ajeet Bhardwaj sir to introduce our speaker and start with the proceedings. In the meantime, if you have any questions, please type on the chat box. We should take your question one by one at end of the presentation. Thank you. Wish you a very good evening once again. Yes, Ajit sir, please.
Hi, good evening, friends. This is very encouraging for us to have the fifth webinar with you all. We have been noticing the kind of unification the profession is going through in this time. And we have in past talked on 4 different topics, including the role of State Council, role of Central Council. Rajesh talked about specific law for any business and the specific laws which optometrists need to follow. And today we are presenting you past, present, and future perspective from international viewpoint and national viewpoint. We'll be also talking to you about what is the way forward for the optometry profession in time to come. So we have 3 powerful speakers today. Monica Chaudhry, she doesn't need an introduction. She is the director of Health Sciences Department at Untitled University. And I will give mic to her to introduce the first speaker, and because she is the main person who will be anchoring and who will be, looking after the whole session. Over to Monica. Thank you.
A very good evening and thank you for the introduction. Thank you, Ollie, for coordinating things. It has been wonderful experience going through it, besides the unfortunate COVID which is going through. And today we have excellent speakers. The first one is Dr. Sima Lal Gupta, whom I would like to introduce her as a friend, as a colleague. She's an optometrist who did her optometry. She was born in US, did her optometry from there, practiced for 16 years. She simultaneously did her master's in public health, and she's going to bring in the perspectives of that US, which she keeps sharing with us, and she compares it with the Indian scenario. She's a colleague with us. She's an associate professor at the university, and we all love her. So I'll hand over the mic to Sima to share her presentation. So,
Sure. Thank you so much. I believe I'm audible. Good evening to everybody. And firstly, thank you, Professor Monica, for such a kind introduction. All of this is possible. The opportunities I've had in India is since I have had acquaintance with her. Thank you, Rajesh sir and Ajeet sir, for inviting me to do this presentation this evening. I hope I will thoroughly cover all of the points requested, and I will be happy to take any questions for anything that I leave off. So I'll begin by sharing my screen in a moment. But as Professor Monica shared with you all, my background is I am a doctor of optometry, which is an OD degree in the US. I also have a master's of public health focused in healthcare policy with a side interest in nutrition. And before that, I did a bachelor's of science in biology and psychology. So I will review the steps in my presentation of becoming an optometrist in the US as well, just so you all can understand what a sought after career it is, and to help everybody understand how the US has reached that point with optometry. It did not happen quickly. It's taken many decades for US optometry to be where it is now. So I will be discussing the minimum competencies to become an optometrist, a doctor of optometry in the United States. So something that Rajesh sir and Ajeet sir had asked me to cover are, firstly, anybody who gets accepted into an OD program and graduates can become a doctor of optometry. But that does not guarantee that they will be allowed to practice optometry. The degree is not enough. They have to show competency through many different levels. So the first is the NBEO exam. This is a series of board examinations, which begins the second of the 4 years of optometry school. So part one, I'm going to go through these one by one so everybody can understand the minimum competencies. Then I will also review some extra requirements depending on the optometrist's desire of which capacity they will be practicing and where. That's also very important. So part one is in the second year, the second summer after optometry school begins. It tests the underlying concepts, everything you've studied those first 2 years. And to help you understand the level of this exam, it is a 2-day exam, 4 to 6 hours each day. So very intensive, covering everything from your gross anatomy to your physiology to your optics. And then part two, patient assessment and management. This is another written exam which covers patient scenarios. And then part three. These 3 parts are compulsory. Part 3 is your clinical examination. So we actually have mock patients sitting in a complete examination lane, as we call it, with an examiner, a proctor, asking the student questions, asking the student to perform certain procedures on the mock patient. So very intensive. I would say part 1 and part 2 are the most anxiety-causing exams. Part 3, many students look forward to because of course it is intense, but this is what we have been training towards. This is after the summer of our 3rd year, just before our final year. These 3 components of NBEO are required by any of the 50 states to grant a license to practice optometry. Now, as I will share with you all more, each state has different allowances for the optometrist. Some states allow injectables. Injectables meaning preparation and performing IV injection for fluorescein angiography, doing intramuscular injections for epinephrine. So many states will require this or allow the optometrist to do this. Then the optometrist must pass the board exam allowing injectables. TMOD, treatment and management of ocular disease. Now listen to the name of this, treatment and management. This is now required for every optometry student to sit for. They must sit for this exam. If they are unable to pass this exam, I believe it's 2 to 3 opportunities. If they're still not able to pass this exam, then they have to take a separate examination for DPA and TPA certification, which I will go to into the next slide. But TMOD is a requirement. If the student passes it, then they get DPA, TPA licensure. Continued professional development in optometry. This is an elective exam, and it is intended if the optometrist is already practicing but wants to get further certification. So it holds them a level above, that they have also sat for this national board exam, and they can write this after their title, CPDO. Advanced competence in medical optometry. Optometrists in the US are very often practicing in hospital settings, along with ophthalmologists in the same exam room, working, co-managing together. So an ACMO is an extra certification, advanced competence in medical optometry. The VA hospital is the government hospital for government employees. They require for optometrists to also have this license. And I'm sure many of you know that in many states of the US, we also have permission for laser and surgical procedures. In limitation, I will review some of the procedures that are allowed. But if you are choosing to practice in a state which allows laser and surgical procedures, then you must also sit for this portion of the board examination. Some of the laser procedures that are happening in some states, not all of them, include YAG, capsulotomy, LASIK, PRK, of course, any type of foreign body removal, that's allowed in almost all states. SLT, selective laser trabeculotomy for glaucoma patients. Some optometrists are even performing this in the US, but it requires regular continuing education and passing of the LSPE. Now, DPA, it means that the optometrist is allowed to use only the diagnostic pharmaceuticals. Next comes TPA, which includes as well therapeutic. But remember, I discussed the TMOD. So if the optometrist in their final year pass the TMOD certification at the national level, they are DPA and TPA certified. There's another level, TPL, which includes DPA, TPA, as well as the right to perform lacrimal irrigation and dilation. The next is TPG, which includes all of the above, plus the right to diagnose and treat. Diagnose and treat primary open-angle glaucoma. And then lastly, includes all of the above. And if you pass the first 3 levels of the National Board Examination, as well as TMOD, you get licensed to practice full scope, which full scope optometry in the United States means you can perform all of these procedures per your state. So not every state allows it, but you are qualified and certified to perform it. Now, what happens if you did not pass TMOD or prior to 1986? So 1986 and after is when TMOD was introduced. So optometrists who graduated prior to that, they have to obtain the DPA, TPA license, or if the optometry student was unable to pass TMOD, then they have to get certified by their state. The next thing I've shown here is an example of Florida. Minimum requirement in the state of Florida, which is a very popular state to practice in, so they have some of the toughest laws. A minimum of 100 COPE approved hours. I will explain COPE in a later slide. 100 minimum hours of studying DPA and TPA. Then you must pass an exam, and then you will be given a TPA certification. So a very formal, regulated process to be TPA certified. In every state which allows a TPA license, the optometrist must also be registered with the Federal Drug Enforcement Agency, because then we are allowed to be prescribing in some states, not only topical drops, but also oral medications. So we must have an active Drug Enforcement Agency licensure. Many states will also then require simultaneously that the optometrist has injectables license, because if there is any side effect where an injection of epinephrine must be given. So these are all simultaneous certifications. I keep mentioning state boards because the 50 states are self-governed. They must follow the federal requirements, but then each state is allowed to let their optometrists practice up to a certain level. So I've just given a few random examples here. New York City, New York, a state that I have also practiced in. They don't require that you have passed TMOD. They do not have injectables allowed for optometrists, but then they do require an extensive TPA certification course. Indiana is an example where only separately from passing the 3 main board examinations plus TMOD, a law exam is required. 2 days ago, Rajesh sir gave a beautiful presentation on the importance of understanding the law within optometry. This is vital for all of us as future and practicing optometrists to understand the law, allowing us what are our limitations and allowing us what are we able to do full scope, because each and every optometrist should be practicing full scope. Now, a state which is more liberal, like Kansas, again, a very competitive state, there is a law exam, a written exam, which is the level of Part 1 NBEO, a practical exam, which is like your clinical skills examination, plus an interview. Only then will they grant you a license to practice in that state. I have also practiced in Tennessee where injectables are allowed. So you have to practice the ISE exam as well as a written law examination. So this is just to give you all a briefing and understanding of how each state dictates, even if you've graduated optometry school, even if you have passed the 4 main NBEO exams, you still have to get licensed by your state. With that being said, it leads us into understanding continuing education. Again, this is dictated per state. We have an association which is regulating our continuing education. It is governing that our hours must be COPE approved by the Council of Optometric Practitioner Education. I have written many a letter to ARBO requesting, I am in India, I am practicing, I am teaching. They still will not accept my CE hours here unless it is COPE approved. The last time I achieved COPE approved credits in India was during the WCO conference in Hyderabad. The others have not been COPE approved, which is the minimum recommendation for a recognized continuing education. Now, just quickly, I'll go through an example. I'm also licensed in the state of Georgia. They're so specific. I have to every year do a law and ethics course. If I do grand rounds, which is my favorite, maximum 8 hours. It cannot all be grand rounds. It cannot not all be online teaching. I have to actually attend conferences. Practice management, there's a maximum. If my state allows injectables, I have a minimum CE requirement for that every year, for laser and surgical procedures separately. Every state has a basic life support and CPR requirement. And if you are audited, which regular audits happen, and you do not have your BLS CPR certification, you will lose your license to practice. And it is very difficult to reinstate that. Average CE requirement is about 38 hours every 2 years. COPE approved credits. Just to quickly go over, to even apply to be an optometrist in the US, you first have to complete 12 years of school education, a bachelor's degree, ideally in a field of health science. You have to take a standardized test, I think similar to the NEET in India. It's called the Optometry Admission Test, checking aptitude in different subjects. Then you pursue your optometric degree. Then you pass at a minimum 3 levels of the NBEO exam, and then you pass your state's requirements. I have at one point in my 16 years been licensed in 4 states, which means I have to keep track of all of the requirements per state. Also, to understand the scope, you work hard, you spend a lot on education, a lot. Public optometry school, I've written in dollars as well as lakhs, but this is going to make you take your education seriously. We are paying the same fees as medical school and dental school. We graduate and we expect the same level of respect. We expect to practice to the highest level of our ability and what the state allows. So comparing public and private school, then separately your books, separately your equipment, which I am always chasing my students to at least have a basic kit. I teach now 20 years later with the same scopes that I purchased in 2000. But very important to acquire that instrumentation, Room and board depends if you're in New York City or if you're in a smaller city. Then your board exams, your fees, your state license. But then look at your capacity to earn. Median income for an optometrist in 2017 was almost 80 lakh rupees per year. So you have a lot of opportunity cost. You study hard, but it's worth it. For the rest of our lives, we have the capacity to earn well. And with this profession only growing. So those were the main things I wanted to cover. I'm sure all of you will have some questions. I wanted to thank again for this opportunity to speak, and I'm very much available for everybody. And I think we will continue with the other two speakers, and I will be here to answer questions.
Thank you, Dr. Sima, for your wonderful presentation. Now I would like to request Rajesh sir to introduce our next speaker.
Welcome, Gunjan, Kaushik, and we are fortunate to have you here. It's very nice for all to know that Gunjan is right now sitting in Australia, and very kindly she agreed to be with us at this hour. Gunjan is a graduate from Elite School of Optometry. She completed her master's from University of New South Wales, Australia. She was a managing optometrist with Luxottica and currently is optometry director at Specsavers in New South Wales. She will share different levels of optometry education, skills, and council registration and renewal, which is followed in Australia and New Zealand and in Fiji. So welcome, Gunjan, and we hope to learn a lot new things from you.
I'd like to start with thanking everyone for including me on this forum. My name is Gunjan, as Mr. Wadhwa introduced me, and I have been practicing as an optometrist in Australia for the last 10 years. I have practiced in, I'm currently based in Sydney, New South Wales, but I also initially spent 2 years working in Melbourne, which is in Victoria. And I like to kind of make my presentation in a way that there is a bit of comparison and contrast to the earlier presentation from Sima Gupta. Just so for the audience, it's a more simplified understanding of how different two developed countries can be in the way they run their health system. So when I first came to Australia in 2006, I came to pursue my master's. And after completing the course, I sat exams through OCAMS, and took me 2 attempts to clear the written exam and then the oral. I'll start the presentation today with the first, starting with the discussion with the pathways of, to practicing optometry. And again, comparing it to what Sima said earlier, you have to do the 12 exam. In Australia, optometry, like in the US, is a very sought after course, almost as good as getting into medical school and dental college. So the HR is a comparative ranking system, and again, it's highest score is 99.95, and a lot of kids who get into the School of Optometry will have a higher, a very high score. It is a 5-year course for majority out of the 5 universities offer it as a bachelor's program, which is a 5-year course. I've got the names of the universities here: University of New South Wales, University of Melbourne, and Queensland University of Technology used to be actually only 3 universities until 3 years ago. And I'm going to sidetrack here a bit. Until 5 years ago, we used to only have 3 universities that would run the course of optometry. And it was realized that we do have a shortage of optometrists to support future needs of servicing the community. From an optometry perspective, and with intense lobbying. Now, a few different models are being tried. Deakin University has a fairly new course, and this course is being run in a very different pattern to other universities, and it's only a 3.5 year course. Its prerequisites are different. Some of the overseas graduates who find it hard to come over and be able to do exams through OCANS would pursue, try and get an admission through Deakin University. This course is under constant scrutiny. I'd make that comment. I would also like to compare it to the Doctor of Optometry, which is modeled after how the programs run in US. However, it's important to understand that unlike US, no matter which of these universities an individual graduates from, their scope of clinical practice is exactly the same. They come out with qualifications for a basic understanding of, a more than basic understanding of contact lens fittings. They come out with therapeutics qualifications. So that changed in Australia in 2007. Again, happened because of intense lobbying by Optometry Australia, a very similar sort of undertaking like what you guys are doing there now. And since then, all new grads have a license to prescribe therapeutic drugs, and they range from management of conditions like uveitis to glaucoma to antibiotic medications. We do see the Doctor of Optometry course as a futuristic course. Like I said, at the moment, I don't think their scope of practice is any different to what the other universities have. But really, where we're headed from here is other universities in time will follow the model of US, and that US has in place at the moment. I guess from here, I'd like to touch upon OCANS, which I mentioned in the briefly before. Bear with me for a second. Yeah. So Optometry Council of Australia and New Zealand, it conducts exams for individuals who are trained overseas who want to come and practice in Australia. And it starts with submitting your qualifications and supporting the qualification with the curriculum that you've undertaken in your study. They do invest a lot of time in going through the details of the curriculum, and they like to draw close comparisons course-wise, or each subject-wise, if you like, to what's being taught and where the standards are. Based on this exam, based on this initial submission of your documentation, individuals are left with two outcomes. One is, whether the program of study has met these standards that are acceptable for them to then go to the next stage, which is the written, and then the clinical exams. However, for individuals who've graduated through universities where their study requirements, the length of study of the course or the curriculum that's covered is not inclusive of therapeutics and other aspects like clinical, like contact lenses and clinical exposure, then they get diverted to other routes like looking for ways to get into the bachelor's optometry program. For individuals who make it through the initial submission of documentation and approval to go to the written examination, the exam is conducted, mind you, I did this exam like 12 years ago, and I'm trying to scratch my memory. It is done over 2 to 3 days and does test your knowledge on the range of clinical skills, the theoretical aspects of range of clinical skills, and the marking criteria is pretty strict. Once you pass that, then the clinical examinations have been conducted for the last 10 years at University of Melbourne, and they're done in their clinics that are used for training their own undergrad students. And for the clinical examinations, you're testing actual patients. I remember for my exam, I tested 3 different patients. And sorry, even before you go into the exam testing the patients, they do test you on individual clinical skill. And that ranges from being tested to see if you're up to scratch on your retinoscopy, on your gonioscopy, on your binocular indirect ophthalmoscopy, binocular vision testing, visual field assessment. As I'm talking now, all of those images are coming into my mind. And then once you pass the skill assessment stage for clinical, then you go on to the patient examination stage. And that's the final stage of the exam from memory, where you would get to see about 3 to 4 patients, and you have to, and someone sitting there making notes, one of the examiners sitting there making notes as you're going through each step with, is the history taking up to scratch, is the, vision assessment up to scratch, is the patient communication up to scratch, is the other hygiene standards being managed well. And then in the end, has the patient been made aware of everything from, what was diagnosed on the condition, what's the management, and when should the patient's recall be done? It's really as simple as that. And then you become an optometrist. I guess I'm just trying to make a joke of that. It does take many trials for some individuals to go through that stage. I guess other things I'd like to share about, yes, the school, I have in my current practice 2 to 3 students who are currently undertaking studies of optometry at University of New South Wales, and they come and work for us part-time. And yes, it is hard for them to have that work-life balance. But because most of these students have a very high ATAR rating, or they make it through really well, and it's a common culture for people who are undergoing bachelor's program to actually be working on the weekends a couple of days, because it kind of adds on to their clinical exposure to being in the workforce eventually. I would like to next go on to talk about APRA. Again, in contrast to what Sima said before, that every state has a different registration and there are so many different stages of registration. Once you graduate from School of Optometry, any of the schools of optometry I've shown in previous slides, you submit your documentation to APRA and the first time when you register, and they take their time and come out with a registration number. And after that, for every year, 30th of November is the date in Australia where you have to go back, and before that you have to go and resubmit your application for registration, and it should be supported with CPD is our equivalent of COPE or CE points, if you like. Up till this current E, the way we did our continuing professional development was it was marked based on points. However, to align it with what other health professions in Australia are doing, and this system is from the end of this year is going to change into hours spent in education. So a new rule will come into effect on the 30th of November and shift from a point-based system to a learning-based system. Like I said, it hasn't been implemented yet. It will come into effect end of this year. Along with all this, there's also a mandatory requirement of CPR, which is a first aid for cardiopulmonary resuscitation for, if a patient has an anaphylactic shock in the room, or for any patients in the practice. Recency of practice is another criteria where I think individuals who are living overseas, I think it gets a bit tricky for them to come back and re-register if they haven't practiced in the country for a certain length of in the last 3 to 4 years time. And for people who are going on mat leave and maternity leave, and I think there's a minimum of working of about 40 hours in a calendar year to continue to register as an optometrist. And like I said before, I'm re-emphasizing, once you're registered, you can practice in any state in Australia. In fact, Australia and New Zealand have you can go and practice between Australia and New Zealand. So we have a lot of Kiwi optoms who come and practice in Australia, and a lot of people from Oz go down to New Zealand and practice there as well. So very, very different, and I like to think of it relatively simple. I guess I want to talk about Optometry Australia and what it's done for the betterment of profession of optometry. And again, it's in a way good discussion and inspiring. I'd like to talk about National Health Scheme and how that supports optometry as a profession in Australia. So this is a way through which all Australian citizens and permanent residents can access healthcare, that is going to see their general practitioner, going to see us optometrists, and a range of other professionals. The cost of that consultation is not directly borne by the patient, but through the Medicare, which is a kind of a card, like a credit card you get, is used to pay for the consultation. It's similar to the National Health Scheme that UK runs as well. So up till the year 1975, optometry was not covered in the list of things that the National Health Scheme would cover. And Optometry Australia, which was previously known as Australian Optometrists Association, came together and lobbied to get optometry on that list. And it's really been a big step forward for optometry as a profession, because it makes it easy for community to access eye healthcare. In 2007, legislation was again included, was changed to include optometric prescriptions. So until 2007, optometrists could not write prescriptions for eye drops. And again, that was a change that was brought about by lobbying by the individual members of practicing members of optometrist community to bring that into effect. And then there is a more recent win of subsidized spectacle scheme, and it has made national standards for looking after our Aboriginal and Torres Island community. So yes, coming together does make big things happen. And I'd like to again summarize what I've spoken about. National registration allows practice in any state, and New Zealand and Australian optometrists can practice. You can come to Australia and go to New Zealand to practice. I guess in the way the clinics run, a chunk of optometrists are owned by corporate. So Luxottica runs in Australia by the name of under the brand OPSM. I used to work for them for 10 years. And Specsavers, which are a very popular brand in the UK, came to Australia in 2010, and they made a significant dent in the market. And now I work for them now. And then we also have some newer players. I mentioned their names there, who we foresee is coming, becoming big brands in Australia in the future. Independent optometrists in the days gone by used to be the chunk of optometry practices, if you like, and the model that was they endorsed was the more small business model. However, over time, a lot of independent practices have now sold to the corporate stores. Therapeutics, I've already spoken about, that all optometrists who come out, who after 2007 who graduate, do come out with therapeutics endorsement. And optometrists who are practicing and did not study as therapeutics as part of their course, it's quite easy for them. I've done this course myself a few years ago. A big chunk of this course is now delivered through similar webinars and online teaching. And then there's a second part once you pass the written exam, where you go and do postings with specialists in a clinical setting and earn your hours. And then there's case reports, which is very time consuming. I think about 5,000 words case reports, one on glaucoma, one on anterior eye diseases, and one on uveitis. In terms of clinical scope of practice, like I've touched that all individuals that come out of any of the universities have similar scope. However, optometrists who are interested in have special interests would go and then become participate in ACPO, which is Australian College of Behavioral Optometrists. And yes, there's a master's course that can be done. They have their own conferences and CPD events. And behavioral optometry, again, is very popular in the community because it supports kids with learning disorders. And specialist contact lens fittings, I guess back in the days, any optometrist who had that sort of an interest would work very closely with an ophthalmologist who would specialize in cornea and contact lens fittings. However, now orthokeratology being a chunk of specialist contact lens fitting, that equations changed a bit, and you see a lot more optometrists doing specialist contact lens fittings. And yes, you can become part of contact CCLSA's Cornea and Contact Lens Association of Australia, and be part of that. I guess that's it from me. I'm happy to take any questions. Thank you.
Thank you, Dr. Gunjan Kaushik, for your wonderful presentation and insight for practicing pattern of optometry in Australia. Now we'll come for the question and answer session at the end of our next speaker's talk. I would like to invite Ajeet Bhardwaj sir to introduce our next speaker.
Hi, I think we have already introduced Professor Monica Chaudhry, and I would give mic to her. So Monica Chaudhry, please.
Yeah. I think it's done. I will quickly run through the presentation, and Ollie, if you can give me permission to share my screen, I'd like to show some slides.
Please go ahead. I have added so.
Sure. Thank you so much. So, of course, the theme, what we were talking in an excellent thoughts which have come in, they're eye-opening things to see where US is and where Australia is, and special thanks to Gunjan. I believe it's almost midnight when she's here with us, connecting and showing it to us. So right from the eastern part of the world to the western part of the world, we have this information and what is coming in India. I like to share some of my past, present, and future things which should help us understand. Bringing in these two people together was the basic thought to understand the levels where the world is. And of course, India is a little, I would say, far behind right now for us, but these are the ways it will evolve into. That's our perception also. So let's actually think about optometry, where it started. And it started actually, to how many of you would know it, that they thought we had the diploma in optometry school, which was more of refraction and quite skilled. Even our teachers came in from it. But in 1976, the whole blindness concept and involving the optometry cadre and bringing in this cadre to AIMS was with this concept only, that they will be evolved into the system by bringing in prevention of blindness. So this cadre, and when Ajeet sir, who was one of the first batch students, it clearly stated there were a lot of therapeutic rights and there were thoughts to bring in this AIMS curriculum, which was for the prevention of blindness. And there were enough of job roles and competencies which were expected out of these cadres which were started. And then we saw the change that happened in 1985, a lot more some schools, some of the old established schools, which we are proud of, they came into existence. But the scenario changed in 90s. We started seeing more of diplomas now coming in than degree colleges. And we also started seeing in the group of ophthalmologists who joined in as an association, FOREC and DOT colleges, which came up. And now what we see in 2000 at the turn of millennium was still worse. We come across 6 months programs, we come across 1 year programs, and optometry, where it should have gone into, has simultaneously been diluted. And this information is picked up from Dr. Narendra Kumar's Optometry Today, an article which he had written. And of course, he's seen through the generations. So some of us have gone through the situation where we were, and we feel very sorry because where we started with, we find that we're landing up into more and more dilution. So of course, at the national level, the government realized, and I feel with the COVID coming in, one good thing, government is seriously thinking about the allied and the other health professionals. They realized with this pandemic which has come in, how important is health. And I think we should see a lot of budget involvement and the government giving recognitions and utilizing this workforce. A very small example I'll give you, the medical lab technologist. They have to train back the doctors again to take the sampling because the lab technologist is not competent enough to even take a sample for it. So they're realizing they're putting in forces. They are even involving the universities and colleges to send their student for this work. So force if we get into that disaster management. So a lot of things, doctors cannot be developed so much as what the country population is. So a lot of burden is going to come onto the allied health, and government is likely to support you all because they've realized it. But all this began in 2012. For some of you who do not know, and the younger lot who do not know. So all this team which is sitting here and many more who are not visible on the screen right now were involved in a report mapping which was taken over by Public Health Foundation of India. It was a government who gave this consultancy to them. And 2012, they came up with a document which said, from paramedics to allied health sciences, landscaping the journey and way forward. So this was at the national level, all the health courses other than the doctors, nurses, pharmacists, and dentist, which was regulated. All the others, they tried to bring in a map and a report and create a report to present it to the government that this is the mapping that we have done. The very important thing that happened at that time was they first removed the word paramedic out of it. However, we listen to our Prime Minister still talking about that word, but the nation has given over this word, and it is now an allied health professional and some health professional, as we'll discuss. So what came up in the report was, of course, what is the current situation? And it was a mess. The government realized. They also quoted one very important thing, which said medicalization of the profession. That means the doctors had dominated all these allied and health professionals so much that they have not grown in the country. And there was a big need for education and regulation. So 2012, the report came up. And that's the time when government started doing meetings and bodies were called. Many of us have been going there. Some of us have been part of that task force. And the ministry, so good thing that started with the ministry is we started the first level, as it is to any regulation, is standardize the education. It took our team also some years to give them the inputs. And with this inputs, government came over with a document which is called the National Optometry Curriculum. So this is the minimum curriculum which was set in. It was uploaded on January 2016, brought in the domain, and a letter of recommendation was written by the Ministry of Health to all the universities and colleges which were running these programs that please follow this national minimum optometry curriculum. But at the same time, the mess was happening. The mess was happening when Skill Ministry was being formed, and under the banner of Skill Ministry, many distorted it. It was not the government's perspective. In fact, it was the misleading perception of many ophthalmologists or NGOs or others who were brainwashing them to bring in this model. And under the Skill Ministry, unfortunately, came in the vision technician, eye mitras, and all these names that you come across. So these are certified skills which were supposed to be helping the eye care cadre or building in a separate parallel cadre. We know we have won half the battle. We are fortunate that we have the team here, the leader here, who built in this case and fought for it, the federation, who brought in to say that, yes, vision technicians and eye mitras from December 2019, no course is recognized beyond that. So we'll not have them produced anymore. At the same time, HHSC also came up with a refractionist, a 2-year diploma, or some kind of ambiguous syllabus. They even defined optometry, I remember, and in one of the initial meetings, we debated. Somehow they withdrew the word optometry from the health skill, and they only remained with the vision technician and refractionist, because UGC had already defined optometry at that time. So what do? We have these two pillars here now. There is one upgrowth which is happening in the profession, which is the Bachelor of Optometry. It's a healthcare professional and not even an allied, as the Ministry of Health defines us or as our bill. And the role is prevention of blindness into all the causes. We are question mark yet into the primary care. We are assumed to be part of the primary care and everything else. But at the same size, the downsize was happening. We have now these vision technicians. I'm told that there are about 15,000 vision technicians who've been created by this time. There are n number of refractionists with what kind of diploma. The focus is totally on uncorrected refractive error. And these are through the reports which certain influenced NGOs or powerful bodies are trying to tell the government that we just need this small cadre, because this is the cadre which will work into the rural areas. An unfortunate discussion which happens and brings them a thought to the government to say, optometrists are so qualified, they don't go to the rural areas. And I dare say, give my optometrist student the salary, he'll go. But they want to have those cheap labor, so they come across those 10,000, 11,000 or 12,000 government salaries and put them in the vision centers. So now this is enough of numbers which is already there in the country. We've stopped them from coming in further by this court order, and they will not. And if you have any information, please pass that order to them so that this doesn't go in. But the blunder is we are not safeguarding our own rights. I don't blame the vision technicians or the other refractionist, but it is the graduate or the qualified optometrist who's not looking into his safeguards. They are the ones who are not understanding. We're leaving it to people to talk about us, but we do not get together into a single forum. So what is all AHB bill coming up? Some of the copy paste statements that I have put in. So we've all discussed this in the previous sessions, that there will be a central council which will frame policies and standards, and they will come up with education and professional services which will come up. They will come up with the conduct code, ethics, etiquettes, and everything that an optometrist has to follow. And we all know there will be an up-to-date live central register. So what is this bill going to standardize? It's going to standardize, number one, the minimum standards of education. And they've already had a first draft of the curriculum, which they assumed it's about 3-4 years, or rather 2016. We're almost end of 4th year of that admissions. And it assumes that all the universities would have adopted it. So the curriculum, and of course, it will be some modifications to it, which even we feel it needs to, but that will be the base what government has started with. It's going to regulate the infrastructural or the instructional facilities, the staff qualifications also, and the quality instructions, the assessment, examination, training, research, continuing professional education. Now, these are the points I've picked up from that bill. This is all going to be regulated now. There is even going to be a regulation on a tuition fee, which any university is going to charge. They're going to tell you that this is the number of seats which you can take over in, and you can run the program. It's not like admitting 100 students in a batch without having those infrastructural facilities. So based on our previous webinars also, which we have told you, as we're talking of education again, let me tell you that you are going to, there is an statement which says there will be a national uniform entry examination with a common counseling for admission. Now this means like a NEET exam, or maybe a portion of NEET exam in the lower levels would come into the allied health programs. So the student will have to have a national central exam, which is like CLAT for law or for the IIT or for the engineering and others. So the same way, even allied health professional will go through this entrance exam, which is uniform, and then he chooses and is counseled to enter into different universities. But remember the bottom line, which I said here, which was told and warned again. There'll be a uniform exit or licensing exam for the allied healthcare, which is typically what we have seen Dr. Sima also talking about it. And the renewal of this license is going to be every 5 years when you're going to pay fees.
Yeah, sorry for the interruption. Looks like we lost Ms. Monica Chaudhry. Please bear with us. We shall connect with her very soon.
Let me know when she joins. Well, I think we have got a background of what exactly happened in US and what exactly happened in Australia. We need to understand how these countries evolved from just a refractionist optometrist to an MTOD or to a TPA or to DPA or to a surgical right. What kind of struggle we have undergone on all these years and the associations have gone, and what these countries have really done to reach at that level. So when they finish, I'll be talking about the historical perspective, how the countries, how this optometry evolved, and what we are at what stage we are and what we need to do where the other countries are. So I'm sure that when Monica will finish, I will be able to take on those things. But till she joins, is she online or still not there?
Sir, you go ahead. It will some time because she has to restart her computer. I think the Zoom app got crashed, so she's restarting it.
To understand where we are, where Indian optometry is, I'll have to go back to what happened in US way back in 1900. The optometry associations, they decided that till now they have been registering vision technicians, they have been registering dispensing optician with them, and in 1900 they took a decision. Now all the interest of optometrists will be taken by optometrist association. So first association that prohibited any other professional in optometry was formed in 1900. In 1901, immediately after they registered, Minnesota state, that was the first state that asked for the registration, or they came out with the law that optometry should be legal and optometry should be a profession which has to be regulated. By 1921, exactly 100 years before where we are today, all states in US, they had the enactment of the law. So they took 20 years to get optometry regulated, legislated. So we are exactly next year when we get the law, we'll be just exactly 100 years behind where the optometry was in US at that particular time. Even in Australia, optometry was just in struggling state at that time. AOA, American Optometry Association, and Australian Optometry Association, both were formed in 1919. So it took them quite a lot of time to get this enactment or to get this legislation. But that legislation did not give them the right to practice any DPA or TPA. And the had to really struggle to reach where exactly where we are today. By 1927, we had the formation of World Council of Optometry. Even the World Council of Optometry we see today, it was previously called International Optical and Optometry League, where we had members from optometry as well as opticians with it. In 1927, WCO was formed. In Australia, from 1913, they got the first state enactment. By 1940, all Australia was also had the legislation in place. But legislation did not give them guarantee. Legislation only meant they were registered to practice, and they were registered to practice only reflection or contact lenses. In 1947 was a historical year where optometry was into the, it was the first time that American Army had appointed an optometrist into their armed forces. So it was a historical moment for all over the world that optometry is officially inducted to the US Army. This was taken as a very big shock by all opposition, by our ophthalmologists. From 1947, optometry went into a dark phase. This is called the dark phase of optometry. From 1947 to 1970, optometry faced a lot of challenges. It was a time when we were struggling and we never knew that if optometry will advance or optometry will close down. It's not only in US, in America also, it was a similar situation. In 1961, American state of Pennsylvania filed for DPA rights. That DPA rights, they were not given. We lost the case for DPA also in 1961. By 1965, when Australian government came, they said that optometrists are not part of NHS. So they were kept out of Mediclaim, and their practice became almost to kind of, they were really struggling. Ophthalmologists all over US and Australia came out with a plan that we will be giving glasses, free glasses with our consultation for eye exam. And the story begins that by 1969, we thought that optometry will not survive. But good things happened in 1971. 1971, Bausch and Lomb came out, the FDA gave regulation or registration for soft contact lenses for Bausch and Lomb. And that was something that turned optometry, gave some new hope that profession could survive by use of contact lenses. In 1975 itself, in state of Rhode Island, the first state that got the DPA right was in 1971. In 1973, we got the right for this in another state of US. And then gradually, by the end of 1987, all over the states of United States of America, we had the DPA and TPA rights. So that's how the profession moved forward from till 1987. While in Australia, we were still struggling with our rights, and there was no right for DPA or TPA till then. In 2000, the association or the council of the two countries, Australia and New Zealand, they merged together to form what Gunjan said about Orange. This is the only council in the world that gives licenses for the three countries, Australia, New Zealand, and Fiji. And they formed a council, and in 2002, the state of Tasmania in Australia, that got the right for the DPA or TPA. And by gradually every province in Australia, and it was followed by New South Wales, and then again in 2000, by 2007, it was the South Province and West Province was the last one to get the DPA and TPA rights in Australia. So that's how has been the struggle by 2010.
Wow.
Yeah?
Yes, that was a great insight. I think we got Monica ma'am back on the screen. So I would request her to share her screen presentation and go ahead with it.
Thank you so much, Oli, for letting me in. And I don't know, technology, something went off and the system just crashed out. I have to restart. Okay.
It's quite common nowadays. That's why I already mentioned them. Please stay back.
We are overusing our bandwidth that we have and something, and sorry, it had to happen now. But of course, as we have been talking, and I was now joined in when I listened to the insights which have been shared by Ajeet sir. But as it was talked over in the bill, that remember, even he has been pointing out that more than 2,000 hours is the only definition of diploma, which needs minimum of 2 years duration, and it has to be a semester system. It doesn't mean that you complete 2,000 hours in 6 months and that's your diploma. No. The second, which is a valid degree information, is that it has to be more than 3,600 hours with 4 years duration in Optometry with the semester system. And that's the UGC Gazette, which came out in 2014. So there is no doubt about it. No 3-year degrees, 3.5-year degrees after 2014 UGC Gazette. So again, we reinforce the fact into the education, where does this whole topic, what we started with on our first webinar, the state and the center mean? So there is a center register, which I told you, which is going to create the whole policies and give you a standard framework. But then it comes back to the states. The states will have to be the executors of it. Typically what you see in US, it may not be that varied kind of thing in what has happened in US or is happening, but it is quite a similar kind of pattern. The education will be standard. So it's like an MCI or a nursing or a pharmacy or a dental course, which is across the country, the minimum standards. But independently, this state can say, yes, I would add this kind of education added over to it. But however, the curriculum will remain standard. I remember if it is Pharmacy Council of India, whether you are in Kashmir or you are in Kanyakumari, you're reading the same pharmacy curriculum, exams, course, everything. But what comes into the states? The states can modify very nominal depending upon their requirements. It's a health subject. But what will come into the state is the retrospective question which each one of us is asking. That I have studied from this state and I have done it. So am I legal or am I questioned about it and all these kind of things. So it is the register which the state will create and the register will be transferred into the center. And suppose there is a particular program and they want to know if it is a state or something. Let me just brief you a little bit on what came in when the government regulated act came in for the medical council. Whatever were the degrees which were RMPs and even some of the Ayurvedic doctors who were practicing medicine here, they did not take them off. They had some kind of clause for them. They had some regulation, but remember, they were only allowed to practice within their state. They were not allowed or given a license to move out of the state. So they continued their own practice, and eventually we see them, they died out. The public was loyal. Those loyal patients they had continued to be with them, but later they could not, because there was something which people knew more than that after the years. So the state body is going to be recognizing those courses whom we are questioning. But before that question is answered, and each one of you is asking us whether I'll be or not, or whether this college is certified or not certified, let me give you how the process of universities and the recognition in higher education. Higher education means any education which is beyond 12th. So there is a recognized university. Let's say the university, how does it frame up? It suppose has to start optometry. Let's say it has to start a degree program. It will first create a structure, infrastructure, design, curriculum, everything, pass through its board of studies, pass through its academic council. Academic council is university's highest body. Now, after it passes, it goes into the Office of Higher Education. So whenever I had to start, I have to first get it passed from the Office of Higher Education. The higher education then would take over my inputs. Even the secretaries now sit down. It's not that corrupt system, and it's not easy corrupt system nowadays. You have to go make a presentation, justify and satisfy all their questions. They may ask you anything. How eligible are you? They can come back to see your infrastructures. And then only once you get that approval letter from the higher education, the course university can start with the admission. They tell us about the duration, they tell us about the number of seats, and that's how it passes. Suppose it's a diploma. The diploma any recognized university can start, but it need not go to the higher education. Universities have the authority to run the diplomas and certificate courses up to the academic council's approval. We do send in an information to the higher council unless they object to. But the academic council is the highest authority in case of diplomas and certificates. So once it is approved by the higher education, it is listed on the website. Now it comes into the preview of UGC or whatever higher ed body which is there. So if it is approved by the state board as the diplomas are, it is this body which is going to be a regulatory body, and we have to abide by the laws and things. So for all those questions who are asking us, I had done from this institution, whether it is recognized or not, see whether your university or the institution followed this pattern. So they have to give you the papers that, yes, I am approved by this higher education authority in the state. And then the state gives the register to the central authority, which is the UGC or otherwise. So please check with your organization or institution whether this certificate of approval from the government higher education body has been taken. And that clearly tells you you're recognized or not. So what are the challenges which will come up when the bill will come, or what is going to come into the future? The major challenge as a university is going to be the teaching faculty, their skills, their knowledge. We have the freshers with those eligible criteria is you have to be a master's, you may have to have an teaching experience, academic experience. However, we feel that these older ones have much better teaching abilities, but unfortunately, they don't have the master's degree with them. Your infrastructures, hospitals, supervision, everything will now come under scrutiny, which was not. Your clinical teaching, communication, a lot of challenges will come up when the bill comes in. So what happens to these degrees and NGOs who were running with the institutions, which may not have even gone through those approval processes? They just started the course where they wanted to, few people got together, designed the curriculum, and students have passed out over the years with this. Now, this is where the state will take a call on it, what to do with them. But remember, like a foreign body which started the DOT program, which is a 3-year degree program. if this student comes to me even for a lateral entry, it's not eligible because my university cannot even take them into lateral entry or exempt them for first year because their degree is totally not recognized. If I have to give them a 4-year degree with the exemption of first year degree, I have to say that they did first year like this, and I balanced it, I equivalence it from that recognized university. So unrecognized courses have no place even to go into the lateral entry as per the law and as per the UGC. Let's talk about a little bit of BOMS, a lot of WhatsApp and social media circulation. BOMS, even we have written to the ministry and the ministry has certified to say, yes, BOMS is not at all a valid degree. Bachelor of Ophthalmology, according to government, is no degree. But what happens retrospectively, maybe the state may permit them, but the state may permit them only to practice in the state where it was. They cannot come out and practice. Maybe that grandfather clause may come in. So that's where the state councils will come in, and that's typically what happens. But we need to understand these shortcuts which have been adopted, all those models are not going to be happy learning right now, and they will face some kind of challenges in getting their licenses and recognitions. So the continuing education and exit exam is something very important in future, which needs to be talked about it by each one of us. And if we see so many of us joining in today, means we are worried about it. So upskilling, upgrading, as Dr. Sima said, that you cannot escape, you will have to do licensing. The licensing will set in pattern. We do not know what will be the kind of credits and licensing, what will be asked for, but that is going to be the process which the bill already says. So the students will have to have all the courses which are minimum, and the balance has to be done. So suppose if your university hasn't taught you law and ethics, you will have to go and read those courses because it is the part of the minimum optometry curriculum in your, which the government has specified. So another quick thought about upgrading from diploma to degree. Again, unrecognized diplomas will not be able to find a place in the recognized universities. So that'll be a big challenge for them to come in. And what about the competencies, infrastructures, diploma schools? We come across mark sheets, paper 1, paper 2. What's your syllabus? There's no syllabus defined at all. So there are institutions which have been giving a diploma. So as a university, if I want to even do the mapping of this course, and I should have at least 70% of those courses mapped, there's nothing in the mark sheets. There's nothing in the diploma. They've just done or learned what? And if I bring them into it, the first year curriculum is biochemistry, microbiology. Have they read through it? No. So they've just refractions of things. So what a mess it will be, but it will be the states which will decide on to this. I'm not the person. It is what the policies will be framed up, but the framing up of the policy will not be easy, and they may be harsh on some of them. So again, what do we need for faculty? PhD 2022 is what is UGC saying, mandatory for any university qualification for a faculty. The NET exam and state level exam is also a minimum part if you are not a PhD to enter into universities teaching, which optometry is not listed, so we are exempted, but PhD enrollment becomes mandatory. How many institutions can actually run through the PhD? The challenge is, where do we get the guides? Research will become very, very important in education, and we will have to really struggle through our faculty. The last, where is the scope? A quick sentence about look at your scope and opportunities. So there is an ophthalmologist, which is maybe 14 or 15,000. Half of them are not surgically active. And they say the urban ratio is 1:25,000. In rural India, the ratio of ophthalmologists is 1 to almost 2 lakhs. So where is the primary care? The primary care is in the rural and the mid-level. And optometry has to understand co-management and evolve into the process where, unless you show that role into it, it will not be the future where they'll accept you easily. A lot of challenges which we have just talked, and we want to break it open. Diploma to degree, masters to higher qualification. And what does a master mean to me? And they come for admission. How does a master differentiate in practice from a bachelor, from a diploma? Has to be defined. Rural model has to be defined. Primary care has to be defined. Please remember, primary care is very important, where we have to fit in. We need to diagnose diabetic retinopathies. We need to diagnose glaucoma suspects and bring them out. So what about those present unqualified professionals? What will happen to it? The only message here again is what we can talk about now is start educating yourself. Make the beginning, start investing in this education so that some of you sitting on a Sunday evening, not watching TV or with your family and talking and listening to this webinar means you've invested your time in it. Both time and money. Spend money on it. You will have to, and invest in this energies. So thank you so much for the panel and everybody who's given me this chance. There's so much to talk and so much to tell everybody, but I wish everything is not going to be bad. So what the only thing is we have to find our way out right now. Thank you.
Wow, that was wonderful talk, ma'am, for the great insight about the scope of continuing education, upgrading skills, and what so on. Now, I wish to invite Ajeet Bhardwaj sir to summarize the talk and then go forward for the question and answer session.
I was going through United States education, and the first OD degree came 2 years after the enactment of the law. It means at that time in US in 1921, when the optometry law came, whole of the US was a diploma level, and they called them apprentice of optometrist. So those are the time the education, the country, the laws has to be so stringent, which we are trying to bring in, that the education is not taken for granted and is not for sale, which is unfortunately happening in optometry in India. And by coming back, I was in year 2007. I spoke from 1900, how the profession progressed from 1900 to 2007. By 2007, whole of America, Australia, and even UK had optometrists, had the DPA and TPA rights. By 2010, we had the law of in Japan, which told optometrists to sit for an exam. So the optometry at the moment in about 48 countries of the world, optometrists have DPA and TPA rights. But if I look back, how this right, how many years it took America, or it took Australia to reach at those rights? It took them 50 years after the law came. Now our law is expected to come in 2020 to be passed, and if it happens, it will be enacted by 2021. Do we have 50 years to wait for it? I think optometry will not be able to survive if we don't take immediate and prompt action. The profession has to stand up, because we have undertaken all the necessary qualifications. We have bachelors, we have masters, we have PhDs in optometry. So it's the time that we need to say to the government. But let me tell you, with my experience in India, we had the first association formed, which is called Indian Optometry Association, maybe in 1962 or 65, but till 2015, when we realized that Ministry of Health is not going to look at any of our issues, and we decided that we go to court, and we filed a court case in Delhi High Court. The demand was that the profession or optometrist should be given the right it was given back to us way back in 1976. And we asked for the Optometry Council, Independent Optometry Council. You must hear this because it's a part of the history what we are talking about. In 2017, I was attending that hearing, and we had ophthalmic assistants whom we said that the right should be given to ophthalmic assistant, because they said that we are also optometrists, and the matter was being heard in the court. And our opposition lawyer, the lawyer who was representing Ministry of Health, he happened to be a Bhardwaj also. So we met outside. He told me, sir, he told me very clearly, he said, Mr. Bhardwaj, you have done a big mistake by involving ophthalmic assistant into asking for the therapeutic and diagnostic right for optometrist. I said, how? Can you explain me better? He said, what do you do? I said, I have an optical chain. He said, do you employ, whom do you employ? I said, I employ optometrists. He said, what do they do in your clinic? I said, they prescribe glasses, they prescribe contact lenses, and they do vision therapy also in some of the clinics. He said, suppose you happen to be there and you tell your optometrist, to only prescribe glasses and you will take care of contact lenses. Can they come to court and fight that I'm not being given the contact lenses work? I said, no, it's my choice. He said, government being the employer have a choice what right they should give to the employees. He said, it's not only for healthcare, look at the army. Army today is deployed in many other situations besides the fighting at the borders. So that day I realized that we had made a big mistake by involving a ophthalmic assistant to ask for optometry strike with us. He said it would have been better if optometry would have fought this battle alone. And I tell you, at this point of time, we are standing at the same point where Indian Optometry Federation, which represents ophthalmic assistant and optometrist, will not be able to meet or not be able to take any cause for optometrist in the court of law, because we have different registration, we have different cadres, we have different ILO specifications in the bill. We don't have the similar rights. So when we don't have the similar rights, we can't fight legally for the cause or in engaging or advancing the profession. Look, at the moment, we have realized that the only way forward, what we have seen, is fighting our cases, because the case for the right we did not get, but Ministry of Health clearly said the right for diagnostic or use of drugs was given to ophthalmic assistant. We did not give to optometry. They said optometry, not a health. He said optometry is a medical profession. The order said in 2017. If any of you want to see that order, please email me. I'll be glad to share that order. He said optometry is a medical profession and it has to be regulated, and we direct the government to make a council to explore the possibility of council. And in 2017, we were told that the board they were trying to form and the idea of ASP council or ASP board, ASP bill was formulated after the court order. Otherwise, the government had no intention to make a council for the profession. So since 1962 to 2017, the profession was at standstill. And now we have got the council. Again in 2017, we thought we wanted to ask for the ban on, because short-term courses, as Monica said, VT and iMitra and many other MLOP and Forex, they were creating a lot of havoc for optometry in India. And we decided that there is no way out. After writing to everyone, we did not get a favorable replies. We said that let's go to the court again. And again, we went to the court, and then few months back, got an order again that all the short-term courses in eye care needs to be banned. Again, we have a challenge at hand. The challenge is that we need to stop these people who are created. There are about 15,000 people who are being created, fight or to infringe on the rights of optometry. We need to go to court again to make sure that they don't infringe on our right. Again, we have a challenge that we need to advance the profession. I am sure even if Parliamentary Standing Committee gives a report that gives them the right, Ministry of Health will not give us the right until unless the direction comes from the court. So we need to prepare ourselves to fight two cases which need to do immediately. There is no way forward. I have been struggling with Ministry of Law, Ministry of Health, Ministry of Education. You write anything, there is no reply, because most of the time, people who are sitting, they don't want any change in the system. They don't want to share anything of their right, which they have given it to most of the NGOs, given it to other healthcare professionals. So we need to see that our rights are taken care of. I would request, we have been fighting this battle for many years. It is the time that profession comes forward. There's a lot of money involved, and there's a lot of the profession has to come and say which until unless you get the right, you will not advance, you will not be able to reach anywhere. Because I've seen struggling in last few years because of so much of competition from Lenskart and this company or that company is getting so much that the margins for the private business is going to be reduced to, or private optometrist is going to be reduced to negligible. So I would suggest that optometry needs to be ready and ready to fight this challenge. We have taken up, three of us, me, Rajesh and Monica, we have taken up this initiative. We want to make sure that we want to upgrade you, we want to provide you reliable and authentic information, we want to upgrade your skills, we want to upgrade your knowledge, and You have seen us doing this is our 5th webinar on this. So we would need the financial support to carry on these activities. Otherwise, any moment like this is not going to sustain. We realized I told only to take up a license so that we could accommodate more than 300 people. First he said that yes, it is possible. We said, okay, fine, we can contribute among ourselves and give 1,400 rupees to review for one license. But then we were told you have to take minimum of 10 licenses, means 14,000 rupees to do such activities in future. So we have to be ready. We have to be financially supporting this activity. And time, I will share it on the Telegram group, what exactly we want. After you people have taken a decision whether you want us to continue our initiative or you just want us to just finish up after the
I think, sir, we will have some questions taken up because Gunjan and Sima first. Oli, if you can take up Gunjan and Sima's question first, because I think it's too late for Gunjan to be in, and then we can continue. And Dr. Sima has been also wanting. So we can have first the people who would like to ask those questions. We can around for some.
Yeah. Yes. So first question is from Rajesh Wadhwa sir to Dr. Sima. Yes, Rajesh sir.
Thank you very much for the opportunity. It was lovely listening to all of you. Now to Dr. Sima, I have a question. When an optometrist registers with the Drug Enforcement Agency, I think that's what the word was, DEA, is there a periodic report that optometrist needs to be submitting, like what drugs were used, including contact lenses or solutions with medical device, how many were consumed and what were prescribed? Is there any such report one has to submit back to the company?
No, sir, not such a thorough report. The license has to be renewed annually. And then the DEA has, of course, the list of what is allowed per state for optometrists. So then, for example, in the state of Georgia, I was allowed to prescribe oral antibiotics, oral painkillers. But then let's say, for example, I'm not authorized to prescribe, Ajkal, everybody is talking about hydrochloroquine. I would see patients with rheumatoid arthritis. I would see patients with lupus, but I could not prescribe hydrochloroquine for them. And if I did by chance, and they took that prescription to the chemist, to the pharmacy, as soon as the pharmacist entered it into the computer, a red flag would pop up that her level of licensure is not for hydrochloroquine. So it's regulated electronically every year. The license has to be renewed, and then there's random audits.
Thank you. Thank you very much.
That's excellent to know. And I think with the digitalization, it'll not be difficult for India even to adopt that policy. So your pharmacist is now going to be challenged if you write a drug which should not have been through your prescription. That's a wonderful way to learn. Thank you.
And it's multiple checks and balances. So if by chance the chemist filled it, they're also liable then for malpractice.
And I feel India will somewhere follow the international systems. These are the models which India is also going to take in. Okay. Any next question, Oli?
Yeah, next question is from Mr. Anil Jain. Please come up with your question.
Hi, ma'am, it was an excellent presentation, but I need to ask one thing. In Australia, in America, do you also have an onslaught of this .com company? In India, they have made a mockery of an eye examination. They come to your home and prescribe all kinds of glasses and go away, and their instrumentation level is virtually zero. That's one question. Let me ask the second one. Over there, do you have an active competition between ophthalmologists and optometrists? Because in India, ophthalmologists go out of the way to denounce our way. In fact, I don't have the recording of that place because in the schools, the telephones are not allowed. There is a very famous center here who have and they do a school touch program where a doctor goes, and in that one of the programs in DPS school where my son studies, they actually said you should not do your eye test with an optometrist, but you should come to an ophthalmologist. But my son, being my son, he challenged her immediately, but unfortunately the phone wasn't there, so he could not record. If he had recorded the thing, I would have actually sued her very comfortably. So I need your position, in Australia and in America. How are you handling at the moment? I know a lot of things are in pipeline, and Mr. Ajeet is working very hard to get this thing in order. But again, it's, as somebody has written, it's a hop and jump and a wait, of 100 years for things to happen. And now you're 37 years practicing and nothing much has changed. So could you please comment on the parts actually? Thank you, ma'am.
Gunjan ma'am, I'll let you go first.
Okay, thank you. I guess if that's of any comfort to you, things used to be like that. And in my 10 years of practice in optometry, I've come across a handful of old school ophthalmologists who would historically, were from the time where they would not have a good referral relationship with optometrists. And that used to be the attitude. However, in the way optometry and eye health is the system work in Australia now, we have quite the opposite of what you were just sort of painting a picture of. We have a referral relationship with the local ophthalmologists, where I know where our clinical boundaries lie. And beyond that, we triage and send patient to the specialist with a referral letter. In fact, the way the system works, and again, it's all electronically regulated through the the drugs question that someone else was asking before, through the pharmaceutical benefit scheme. Similarly, for a patient the way the eye health system works in Australia is optometrists are GPs or general practitioners for eyes. So if a patient wakes up with a red eye, if a patient wakes up with a headache, if a patient wakes up with floaters in their vision, if a patient wakes up in the morning and goes, I can't read, their first point of call is to go and see their local optometrist. Some of them will detour and go and see their general practitioner, who will then refer the patient to their local optometrist. And through the level of testing conducted at the optometry practice, which would include range of testings, so not just slit lamp examination and visual acuity. They have access to OCT. There are criteria set for when the patient should be dilated or not, when the visual fields should be done or not. Because remember, every test that you do, the patient, Medicare pays fee to you on patient's behalf. So you have to do the testing that's appropriate for the particular patient based on the history taking, and good record keeping is the crux of maintaining that sort of good system and channel going. So in that example I was giving you before, if a patient wakes up with a headache and they come to us and we've done the testing and known that it's they've just got they've just become presbyopic and it's the first time they've noticed, and we follow that path. However, if it turns out through the testing that the patient has an unusual looking optic, and the OCT then confirms that it's a raised or suspicious looking optic disc, and I know that at that point it's outside the scope of my clinical practice because this patient will now need an MRI scan, then I will write a referral and sometimes even ring the local optometry practice, local ophthalmology practice to then book the patient in. Because in that particular example I've just given you, it would turn out that the sooner that patient gets the MRI done, the better. So I hope that answers your question. And similarly, on that topic, cataract surgery is another classic example where we would refer the patient to the specialist for the cataract surgery based on what the vision's like and how the patient's feeling about their vision. We don't keep waiting. And once the cataract surgery is done and the patients are off their drops, then the specialist will refer the patient back to my care to then, help them with the needs for glasses and ongoing eye health care, till at some point in the future, they have another issue that arises that they need to go back and see the ophthalmologist.
That's great. Yes, sorry.
No, sorry. I hope that answers your question.
Yes,
I think we have Dr. Sima add into it.
I'll just briefly add to that. It's very similar, just as Gunjan ma'am was saying. The US laws have taken decades, just like Ajeet sir was also reminding us. For ophthalmology to accept optometry has been a very tedious, lengthy process, and it continues. So the states, as you saw, some states allow more rights, some states allow less rights, and you can imagine it's the ophthalmology lobby that's restricting the states that are giving optometry less rights. So joining our local political action committees, financially supporting and donating to our associations keeps the optometrists fighting to keep our rights and expand our rights. There will always, I believe, sadly, be some ophthalmologists who don't embrace the role of optometry. Myself being at heart a public health optometrist, ophthalmology needs to recognize our core foundation and let ophthalmology concentrate on invasive surgery and let optometry really do everything else. The US is still struggling with that and expanding daily. And because of the action and hard work of our optometric leaders, just like we have here in India. And just to comment quickly on the .com situation, something I am grateful for is the 1-800 contacts, the type of the companies that are making your prescription lenses and sending them home to you, they still require a prescription by the optometrist. And it has to be valid, it cannot be expired. And therefore also, if I get, and they have to refer back to the optometrist to validate that online prescription. And so there are still checks and balances. And one other thing is if a patient ever came to my office requesting their PD, that let me know that they're trying to order their specs online. And what my office did is we had a full form the patient had to sign, knowing the risks involved, that my office would not be responsible for any remake. And then I would charge them $50 for their PD.
I think wonderful. And the expression which both of you have told us, it's the associations, the message is very clear. The associations and the contribution by an individual, which has come over from optometry to ophthalmology, and they have not come in easy. It's the funding and resource. It cannot be one person or two person fighting without money. And yes, $50 for PD for an online prescription, if given that right, we'd even love to do that. Thank you so much. We'll have the next question, Oli.
Great. Next question is from Mr. Optom Hamza Qureshi. He would like to understand the infrastructure and regulation of optometry schools in US and Australia, minimum requirements to run optometry school, and also qualifications for faculties.
Okay, so we'll ask the first question is basically about the faculties. Qualification and what is like we have 12th with size as the minimum qualification to come into. Both of you, if you can just give us that kind of insight in both the continents.
Most of my faculty were ODs or vision scientists. So bachelor's, master's, and PhD then in vision science or combined degrees. And we also had lots of visiting MD ophthalmology visiting faculty as well.
And I believe it's a long process. You just do not get into optometry after your 12th. You have to do a lot more steps before you reach into that optometry.
Yes, absolutely. 12th pass with high marks, and then a bachelor's degree, again with high marks, and then passing the optometric admissions test and interviewing and being accepted into a program.
Thank you. Gunjan, you'd like to add in?
I guess I'd just like to second Sima. Yes, all the staff, faculty at both the universities that I've studied have, at the very least, had a license to practice. And most of them would have a PhD and some sort of a interest that they're pursuing while they're a faculty at the university.
Thank you. Oli, if we take in the next one.
Thank you. Yes, coming to the next question, Optom Rahul Chaudhry wants to know how much does it cost in Indian currency to appear for OKANS?
Okay, that's for Gunjan. So they
Yes.
wanted to know the I don't think so. We can apply direct, is it?
Like I said, so the the first step to apply for CANS is to fill in an online application and send in your documentation, which very similar to what you were saying, Monica, before about they look into the nth detail of the courses that have been undertaken in the 4-year degree program. I think it has to be at least a 4-year degree program. And as I was mentioning before, that and they want the course to be pretty much at the same standards at what is being taught in Australia. And once, so most people who would come to Australia and would be able to pass through that stage are, we do get a lot of optometrists from UK, some from Canada and US. But that's the big chunk of it.
I think we have to really upgrade ourselves into be satisfactorily passing through those exams. Thank you. Any more questions, Ollie?
Yeah, coming to 2 common questions. So 2 of them wanted to know approximate cost in pursuing either bachelor or PhD in Australia. So Dr. Gunjan, please.
I think a bachelor's program would cost about 20 to 30 grand, depending on which 20 to 30 Australian dollars, depending which university you go and attend that program to. University of Melbourne offers the OD program, and over a 4-year period, it would cost you 200,000 Australian dollars. And that's just the course fee, and not including the investment in equipment, and obviously the boarding and living costs.
Thank you. Thank you. Ollie, any more? I think
no online questions probably were. Yes,
I think
we're running out of time probably.
We're running out of time. We'll close in because it's going to be dinner time. And I know ladies are all committed. There's no housemaid right now. We're under lockdown and we fully honor their time. And Dr. Sima's got 3 more kids who must be hungry, and Gunjan is almost breakfast time reaching in there with Australia time going in high. I think we can take up the questions through chats and other things, and there are a lot more things which everybody likes to know. We will bring in that. I think to sum up, we can have Ajeet to just wind up and sum up the show.
Yes. Looks like there is an issue in his audiovisual system. Can Rajesh sir summarize this talk, please?
Yeah, Rajesh sir, if you can come up and wind up and say note of thanks to all.
Thank you, everybody. It was wonderful. Monica, Dr. Sima, Gunjan, and Ajeet sir, you handled it very well. And thanks so much to Oli. And we have learned a lot today about where we will be heading in decades to come, perhaps. Thank you, everybody, and all the participants for bearing with us and watching us through the YouTube channel and into the chat. Thank you so much. Grateful. Over to Oli.
It's thanks again all of you for especially for the speakers from East to Western Coast. It's a great pleasure to have you all on this webinar, and for the participants as well for being us and interact with the speakers. This video is going to be live on the YouTube. Even after the session, it will be there. If there are any questions, please come up with it. We should be able to answer to those. And wish you a very good evening, all of you. Thank you.